My worst fear is that I would live the rest of my life paralyzed.
I became a clock watcher, and I began to worry.
What would happen if my mom doesn't come out of this?
The pain had gotten so great that the morphine wasn't working.
That is when I lost it.
I kept asking him, is there anything we can do? And he kept saying, no.
Next, two medical mysteries that defied the experts. Jennifer Fagenson thinks she just has a sensitive stomach until emergency surgery reveals a life-threatening illness.
It felt like there was a balloon being blown up inside my stomach.
Joyce Gonzales is suffering from recurring pain. If her condition isn't treated, paralysis or death could occur. But then she discovers that the treatment may be just as risky.
And the symptoms were so unusual that they just didn't know how to help.
When illness strikes, we look to doctors to give us answers. But what if they can't? For these unlucky patients, diagnosis is a mystery. In New York City, Jennifer Fagenson is the star of her high school tennis team.
I began playing tennis when I was very young, and as a teenager, I was very into sports and very athletic.
At 16, Jennifer is in top physical condition. But on her first ski trip, her health takes an unexpected turn.
My father planned a trip over Christmas to go to Aspen so I could learn how to ski. When we got to the hotel, some of the people that worked there had told us to take aspirin to help us prevent altitude sickness.
It is Jennifer's first time skiing and her first time using aspirin. She takes 2 tablets and hits the slopes.
My father had gotten a private instructor, so we went and we had a 3-hour lesson, and it was very tiring, but it was so much fun, and my father and I had a great time. And then we went to lunch.
But at lunch, Jennifer's ski trip suddenly starts to fall apart.
I was very nauseous and very faint feeling and tired.
The only thing I remember was that she didn't go skiing that afternoon because she wasn't feeling well and she thought it was altitude sickness.
I went back to the hotel at that point to lie down and try to feel better. I woke up in the middle of the night and my heart was beating really fast, and I ran into my parents' room and I screamed, "Mommy," and the next thing I knew, I woke up on the floor. My mother called the doctor, and the doctor said it sounded like altitude sickness because fainting is a symptom of altitude sickness. So they put me into her bed, and about an hour later, I fell back to sleep.
I just didn't think that anything serious could be going on.
I stayed in bed for the next 3 days, barely eating and drinking a lot of water, still taking the aspirin 3 times a day.
But Jennifer doesn't get better. In fact, she gets worse.
I remember being woken up in the middle of the night by this noise, only to find my sister throwing up over the side of the bed. So I ran in and got my parents.
In the dead of night, Jennifer's family rushes her to the office of a local internist.
I was uncontrollably shaking, I think because I was so cold, and I was pale, pale white. All I remember thinking was that I just wanted to feel better. Just asking God to just let me feel better.
I remember the doctor throwing out the word leukemia. It was my mom's reaction that made me realize that leukemia was really serious, because she kind of panicked. And it just got us all really scared.
The internist performs a series of tests, hoping to zero in on the cause of Jennifer's strange symptoms.
They took blood, they took a stool sample, and that's when they decided that, or diagnosed that I was bleeding internally.
They know Jennifer's bleeding, but they can't find the source of the hemorrhage. Jennifer is rushed to the nearest hospital. By the time she arrives, she has lost nearly 20% of her blood supply.
We got to the hospital, and the doctor came in and said that I was going to need a blood transfusion.
Before Jenny had the transfusion, she was completely white. Her face was white, her lips were white. She looked like a ghost.
Jennifer receives 2 pints of blood, bringing her levels back to normal. Numerous tests show she does not have leukemia.
I just knew that I was bleeding somewhere inside, and that was very scary to me. But it gave me the blood transfusion, and by the next day, I was feeling much better.
A day later, she's discharged from the hospital.
When they discharged me, they had never found anything. They never found any holes or any sores or any, open wounds in my GI system that would cause the bleeding. So They assumed or diagnosed me with an allergic reaction to aspirin, which they said had caused some type of ulcer sore in my stomach, which had bled, and once I stopped taking the aspirin and had the blood transfusion, it had healed, and that's why they couldn't find anything.
But Jennifer's parents aren't satisfied with that explanation.
When we got back, my parents decided to take her to the doctor to have some more tests.
Back home in New York, Jennifer has an endoscopy and a colonoscopy, 2 tests that give doctors a look at the inside of the digestive tract. But the tests appear normal, and the New York doctors agree that it was probably an allergic reaction to aspirin that caused Jennifer to bleed.
I just assumed I had a sensitive stomach, and that's probably why I had such a reaction. So I just figured that if that's all it was, then that's great. Then I just won't take aspirin.
Jenny seemed fine and healthy, so we both went off to college, and everything seemed to be okay.
My freshman year was great. I loved being away from my parents and meeting new people.
But in college, Jennifer begins to develop a new symptom.
My lifestyle was changing and going out more and drinking and eating less. I started to get some gas pains, but I just figured it was because I wasn't eating enough. Drinking too much coffee, all the things that you do wrong that can upset your stomach.
And then, one day, Jennifer's stomach pains become too uncomfortable to ignore.
2 of my girlfriends and I were on our way to Canada. On our way there, I got these terrible gas pains. I was in the backseat of the car, and I could not sit up straight. It was just this terrible abdominal pain. My girlfriends were really anxious, and I was telling them, this is bad. This is worse than I've ever felt. But we're in, middle of Michigan. On our way to Canada, we don't really know where we are. But eventually, we found a hospital, and we went to the emergency room. They briefly examined me and decided that it was just severe indigestion and gas. So they gave me some antacid and some water and told me to go home. When we went home, I got in bed, I laid in bed, I fell asleep, and in the morning I woke up and I was fine.
Jennifer takes antacids through the remainder of college.
The thing was, in our family, taking antacids and anti-gas tablets was like a regular thing. So it was really not unusual to see her taking something like that.
The antacid diet continues when she begins her career on Wall Street and starts to experience a new symptom, bouts of diarrhea.
I started working on the New York Stock Exchange, and it's a very hectic work environment. You are only really allowed 2 breaks a day. So if there's something wrong and you need to go to the bathroom, of course they will let you go. But nobody's going to want to work with someone who's always running back and forth to the bathroom. So sometimes it was difficult, but not really in the beginning.
Then, one morning, a familiar, unbearable feeling returns.
One day I woke up with this terrible, terrible stomach pain. It felt like the worst gas pain possible. And I could not stand up straight. And I was scared, and I started to feel faint, like I had felt, an aspirin when I was first sick. And I was so afraid of getting sick in a cab that I went and got my car. I was going to drive up to the doctor, and I could not physically stand up erect without it hurting. I was extremely scared.
For the past 10 years, Jennifer Fagenson has taken antacids to calm her frequent indigestion, nausea, and diarrhea. Then, while working on Wall Street, her stomach problems suddenly become unbearable, and she schedules an emergency appointment with her doctor.
The doctor said that it was a viral infection in my colon and that I should not drink or not eat for the next 48 hours.
Jennifer stays in bed for 4 days, and gradually her stomach pain subsides. She assumes it was just a virus after all.
Because of where I work and the closeness of everybody, the close proximity of everybody, there's a lot of germs. So I just figured I probably got it from someone that I work with.
Jennifer doesn't give much more thought to her stomach problems until she meets Josh Young, and they begin to date.
She was very witty and smart, and had a really great sense of humor, so I was attracted to her.
I felt this incredible feeling of safeness with him. I just wanted to be around him. I didn't tell him about my stomach in the beginning.
But it's hard for Jennifer to hide her symptoms, and sometimes they come at awkward moments.
The first time that I knew that Jenny had stomach problems, we were sitting at the kitchen table with my mother and my father, and it was the first time she was being introduced to my family. And she started to feel sick to her stomach and was almost green. She left the table and was in the bathroom for a good 45 minutes to an hour. I just thought that it was really something that she ate.
But after a year and a half of dating, they move in together, and it soon becomes impossible for Jennifer to hide her symptoms from Josh.
I was never a big cook. I don't think I opened my pots and pans before he moved here. So we would order out a lot, you know, sushi, pizza, Chinese.
She's like a sushi fanatic. Usually 2 or 3 nights a week, she would order sushi, and after she would eat the sushi, we would usually fall asleep, and then I would wake up at different times throughout the night and notice that she wasn't there, knowing that she was in the bathroom. Sometimes she'd be gone for an hour, sometimes she'd be gone for 2 hours, sometimes she would get up 5 different times throughout the night. So I thought eating the raw fish was not a good idea.
And we all thought the exact same thing. We all thought she's got stomach problems because she eats too much raw food and too much sugar.
Then, Jennifer's stomach problems are accompanied by a new, seemingly unrelated symptom.
I was getting this terrible back pain, and I just thought maybe it was from standing all day.
And I actually called the spa to get her a massage for her back. I thought maybe that would help her. Maybe she was just having muscle spasms.
I knew she was complaining about back pain, and she thought if she went to the gym or she stretched or something that it would get better.
A lot of people that I work with tend to have lower back problems because of the pressure from standing all day. Eventually, I went to the gym to work with a trainer and told her about my back problem. She told me a whole bunch of abdominal exercises, which I started to do regularly in hopes that it would alleviate my back pain.
For weeks, Jennifer continues to struggle with recurring stomach and lower back pains, but is convinced that nothing significant is wrong. Then, one weekend, her symptoms become more serious.
Josh and I were planning to go down to the Jersey Shore to stay with my parents for the weekend. And I woke up at about 7 in the morning with this severe abdominal pain. It was really terrible pain, and I told Josh, and he got angry with me.
She said she didn't want to go to New Jersey, so I think I said I was going to go by myself, or that she should just stay here, and I'll go, and then I'll come back or whatever. So she was, you know, a little bit offended by that.
Despite her pain, Josh ultimately persuades Jennifer to go to New Jersey with him.
So we got down to New Jersey, and I told my mom I wasn't feeling well, and she said get back in bed. So I was in bed for about 4 hours.
She was having like these waves of pain. She would really be in excruciating pain.
I woke up, and I saw my mom, and I said, Mom, this pain is just so bad. I need to go to the doctor, or I need to go to the hospital.
I'd been on vacation in Italy for a week, and when I landed, I called to say what train I was taking, and I was then told that my sister was in so much pain that my mom decided to take her to the hospital.
Stephanie heads straight to the hospital, and when she arrives, Jennifer seems much better.
They gave me morphine, so I was fine. I didn't feel anything, I didn't care, I was in love with the CAT scan lady. I mean, everything was fine to me. I just wanted to leave. You know, I just didn't want to be there anymore.
But the tests they've run so far have yet to provide any answers.
They'd taken for a CAT scan and an X-ray. They still couldn't figure out what was going on.
And they noticed that her white blood cell count was extremely high, meaning that she was fighting some kind of infection.
That's when the doctor decided that I was going to need laparoscopic surgery.
Laparoscopic surgery, or keyhole surgery, is used to diagnose gastrointestinal problems. It is done through small incisions in the abdomen using a video camera. Jennifer is immediately transported to New York for the surgery.
When they put me in the ambulance, the morphine had worn off. It was just probably one of the worst hour and a half of my life. And I was scared. I was very, very scared.
Pain was just overtaking her. With every bump that we hit, she would cringe with pain.
You watch this person that you really care about in so much pain, and you can't do anything to alleviate it, and you don't know how to fix it. You hope that the doctors know, but you just feel really helpless.
Jennifer arrives at Mount Sinai Hospital in New York, where surgeon Mark Reiner is called in to perform her procedure.
When I got there, Jennifer was there with her family. Her heart rate was fast, she had a fever, she was quite pale, she was very, very uncomfortable, had laboratory data conclusive for a large infection somewhere, had a mass present in the abdomen, in the left side of the abdomen.
Dr. Reiner seemed to be a little bit puzzled by what it was, by looking at the scans, but was very straightforward and pushy in his ways of getting to the bottom of this.
Whether or not it was a tumor or perforation from a foreign body or something more obscure, I was unsure. It was obvious that she was quite ill and was going to need to be explored surgically.
As I wheeled Jenny out of the room, I told her that I loved her very much.
But The last thing I remember before I went to the surgery was telling my father that I was scared.
And I took Jenny to the operating room. We put her to sleep. I sterilized the abdomen on the surface, and I made 4 or 5 small incisions for which I could put in a laparoscope. It was obvious as soon as I slipped the scope in that there was something going on. So there was combinations of swelling, redness, acute infection, and partial obstruction of the intestine. I decided that there was no way that I could safely do this laparoscopically, and I converted her at that time to an open procedure.
Out in the waiting room, Jennifer's family is worried.
We were expecting to see her again in an hour to 2 hours, like Dr. Reiner had said, and the time just kept going.
They made an incision in the abdomen. There was evidence of inflammation, and once I took some of the small bowel loops, the small intestinal loops, off the area of inflamed tissue, I found something that we don't often see. I certainly wasn't happy.
Jennifer Fagenson has been suffering from terrifying bouts of internal bleeding, pain, and nausea since she was 16 years old. 2 hours ago, surgeon Mark Reiner opened her up for exploratory surgery. Now, he thinks he knows what's been causing her symptoms for the last 13 years.
I found a tumor. It was 2.5 to 3 inches in size, growing outside the bowel wall. I removed the tumor. At that time, though, we can't really tell whether it's an aggressive tumor, whether it has the tendency to grow very fast and spread or not.
The tumor is sent to the lab for analysis, while Dr. Reiner cuts out the affected part of Jennifer's intestine.
If you look at the intestine as a long garden hose, she lost a piece of this garden hose, and I needed to then reconnect the garden hose in some way so that when she ate, we'd establish normal flow of food through the intestine. It was always the potential possibility that where we put the two ends together, that they would not hold. And if that occurred, then there's a good chance that Jennifer would not live.
After 6 hours, Dr. Reiner completes the surgery and sews her up. Now he has the difficult responsibility of informing her family and Josh of her serious condition.
I immediately knew that something wasn't right. It had looked like he had just been through a war.
I explained that we're dealing with a tumor, explained the fact that she may or may not have to be reoperated on, and that she was very, very ill.
He proceeded to tell us that he took out like 1.5 feet or 2 feet of her intestines, and that if the recovery process did not go well over the next couple of days, that it could be catastrophic.
To hear someone talking about your little sister like that, it's really hard.
And that is when I lost it completely. I ended up sitting in the elevator bank, pretty much screaming at the top of my lungs and crying to my father over the phone.
The worst was seeing Josh. I'd never seen anybody that upset. I remember he said, "I finally found her and now I'm gonna lose her."
Knowing that a successful recovery is crucial to Jennifer's life, her family waits nervously as she's moved from surgery to intensive care.
We waited and we waited and we waited, and it wasn't until 2 a.m. that we could see her.
I didn't really know much of what was going on. Apparently I had a breathing tube. I don't remember that. But nobody would tell me how severe the surgery was and that there could be all these complications.
It has been 8 grueling hours, and now Josh can finally speak to Jennifer.
He told me about the night that I was in the hospital and how after my surgery, and I can't do this. I'll let him tell you about it.
I told her that no matter what happens, that I'm always going to be there for her, and that I was there for her from the beginning, and I'll be there with her to the end, and that we would get through it together.
Within 3 days, tests show that Jennifer's intestine has mended properly. She won't need additional surgery. But on the day Jennifer is leaving the hospital, she gets bad news from Dr. Reiner.
Dr. Reiner told us that the pathology reports are back and that it is malignant cancer.
The pathologist came and read this as a GIST tumor.
A GIST is a cancerous tumor that grows in the supporting tissue of the digestive tract. If it gets big enough, it can cause pain, internal bleeding, and an ulcer. Left undetected, it can metastasize and kill.
She kept saying, "Can you believe this happened to me?" And see, I knew there was something wrong, and it wasn't just sushi.
I can't believe that I suffered for so long not knowing this.
There are only about 5,000 cases of GIST tumors reported in the United States a year. Most of the ones we see are in patients between the ages of 20 to 50. Many, many women in this age group and men have intestinal issues and problems that are completely unrelated to GIST tumors. It's why it's so difficult to make this diagnosis.
1 month later, Jennifer is put under the care of an oncologist and begins a treatment to prevent the regrowth of cancer cells.
He has decided to put me on a medicine originally used for leukemia patients. I have to take one 400 milligram pill every day.
6 months later, Jennifer is cancer-free.
Now I'm great. My insides are functioning like a normal person. And therefore, the rest of my body is getting all these nutrients that I think it was being deprived of for a really long time. So my nails are stronger, my hair is shinier.
She said that having scars kind of sucked, but that if that was the worst thing that came of this, then she'll take it.
That Jennifer is perfectly fine. She can eat anything that she'd like. She has no restriction on activity, food, work, or play.
My plans for the future with Jenny are just to keep living, have her get better, get through the cancer. They want to stop the medication after about a year or so.
I think the only thing that could have helped it is if I had spoken up, maybe a couple years ago. If there's one thing that I learned from this, it's call your doctor when you're not feeling normal. Instead of waiting and trying to fix it and, first sign, just call your doctor.
Jennifer Fagenson spent years downplaying what turned out to be symptoms of a very serious condition. But for Joyce Gonzales, telling anyone who would listen about her strange symptoms did little good.
I've lived in Santa Fe my whole life. A lot of generations of my family have lived there. And it was really, really important to us that our children be raised with family and the support that comes along with that.
In the spring of 1980, Joyce Gonzales and her husband Greg celebrate the birth of their first child, Antonio, in their hometown of Santa Fe.
I don't think I could have asked for anything more at that time that could have been better.
But things do get better. In 1983, their second child, Nina, is born. And for the next 6 years, the family leads a happy and healthy life.
When I was young, I really thought that my parents were invincible. I never thought anything bad could happen to them.
But then, one day in 1989, Joyce sits down at her dining room table to drink a glass of water. And in an instant, everything changes.
I happened to put my left arm down on the table. And from about my pinky to my elbow, I felt some intense pain that I just had never felt before. It was very unusual. It felt like if my arm was burnt or maybe as if I had pins or needles sticking in it.
I asked her if she had slept wrong or had burned herself that she wasn't aware of or done something that might have brought on the pain. She couldn't recall anything that may have done that.
Joyce takes some ibuprofen in hopes that the pain will go away overnight.
I woke up in the morning, I still had the same sensations in my arm, so at that point, I decided I would make an appointment with my family physician. He did a general neurological exam. He told me, well, possibly it's carpal tunnel.
Carpal tunnel syndrome is an inflammation of the tendons in the forearms and wrists, often caused by repetitive motion.
He said, why don't you try some arm splints?
Joyce did quite a bit of computer work. Actually, it was a bit of a peace of mind because carpal tunnel was something that could be treated.
I thought wearing the splints would help.
But the discomfort in her left arm does not go away. And Joyce is alarmed when she notices the pain beginning to spread to her other arm.
It was really beginning to concern me.
It became evident that the carpal tunnel was progressing or it was something else, and in the back of my mind, the something else started to take center stage. One
month ago, Joyce Gonzales was diagnosed with carpal tunnel syndrome in her left arm. But now the pain in her one arm has spread to her other arm, and she is having trouble coping with her symptoms.
I so desperately needed relief that what I started doing is getting ace bandages and just wrapping it around my arm.
Putting pressure on her arms would assist in the pain she was having, but I had to be very, very careful because too much tension would cut circulation to her hands and she'd get numb hands, and not enough wouldn't do the job either.
Every day for the next 4 weeks, Joyce alternates between painstakingly wrapping her arms and wearing uncomfortable splints.
I had small children. My son was in about 3rd grade. My daughter was in kindergarten. I think it was kind of difficult for them because they weren't sure why Mom was wrapping up her arms.
But wrapping and wearing splints only provides mild temporary relief. It doesn't truly stop the pain.
I was feeling so desperate because the pain was intensifying.
I would see her hit her forearms. I kept saying, Mom, don't do that. Stop it, you know?
We tried ice packs, sometimes heat, and that seemed to help every now and then.
I feel like if I have ants biting my arms all the way up and down and I just can't make it stop.
Joyce decides that it's time to consult a pain specialist, but she's disappointed with what she's told.
The specialist believed that I probably had carpal tunnel. He recommended that I go to physical therapy.
They made her do different kind of arm exercises, not only to strengthen her arms, but more importantly, pain control.
Unfortunately, it did not help in any way with the pain.
And I think she was very discouraged, and I was too.
My dad was always really, really involved in our lives and helping out my mom, and basically anything she needed done, he would do it.
But as Joyce's pain escalates, she becomes more reliant on Greg, and she's not happy about that.
Joyce has always been very involved with kids, and even the smallest amount of detraction that this disease may have had on our raising the kids disturbed her.
One day, I went into work and I was so frustrated. I had taken the kids to school this morning, but I felt I was very distracted because the pain was intense, and so I just broke down and cried at my desk.
I think Joyce felt because she couldn't give 100% of the time to the kids that she may not have been the best parent around, and I disagree with her. She did the best she could under some very strenuous circumstances.
At this point, both of my arms were hurting, and I was also having some weakness in my hands.
This new symptom is the last straw for Joyce, and she begins searching for answers on the internet.
I'm a researcher by nature, so I got on the computer and I would look up different illnesses that would affect your arms. And what I found was things like Lyme disease, rheumatoid arthritis, different things like that. So I decided at that point to maybe make another appointment.
Joyce returns to her general physician for additional tests.
Anything that he could think of that might be affecting my arms, he did testing for it. He still felt that maybe a type of arthritis might be going on. So at that point, he sent me to one of his colleagues who was an arthritis specialist.
The specialist diagnoses her with a condition called chronic pain syndrome. Chronic pain syndrome is long-standing pain that is not relieved by treatment. It is often caused by an injury or overactivity in the nervous system. It's a common problem, affecting 10% of adults.
When chronic pain syndrome was diagnosed, my first reaction was, what?
I felt frustrated because I thought, well, I could have figured that much out, but I still don't know how to stop this pain.
Joyce has now been suffering for 10 months, and the pain is only getting worse. As the weeks pass, there seems to be no end in sight.
And I was not getting any relief. If anything, it was becoming more intense. No one was giving me any answers.
For over 10 months, Joyce Gonzales has been suffering with severe pain in her forearms. She's been diagnosed with carpal tunnel and chronic pain syndrome, but no treatment seems to work. In December of 1989, she heads back to her general physician.
When I went to see my general physician, he felt like it was time to send me to a neurologist. Maybe they might be able to find something or discover something that no one had found so far.
We were optimistic. We were hoping that whatever came out of it, we would find out one way or the other.
He did some special testing on my arms, and he wanted to do an MRI of my neck because he said anytime you're having arm problems, it tends to stem from the neck.
A week later, the MRIs are back, and what they reveal is shocking.
He told me, well, I see something on your spinal cord in your neck, but we'll need further MRIs to really confirm what that might be.
Joyce is terrified as she undergoes a second set of MRIs.
When she returned the second time, I wanted to be with her because I wanted to see what he had found.
But this set only brings more bad news.
And he told me, well, it could be a tumor. At that point, I told him that I was having headaches. And he said, let's also do an MRI of your brain and see what else we might see.
Joyce has a third round of MRIs.
On my third visit, he told me that I had a lesion on my spinal cord and several of them in my brain. However, he said it had nothing to do with my arm condition. Well, that did not comfort me in any way. I said, what could happen because of this? And he just said, you might have a stroke, and then again, maybe you won't.
The doctor did say that it could also cause paralysis.
My biggest fear was not that I might die from it, but what did scare me was the possibility of being paralyzed.
It was a very disconcerting thing to think about.
The doctor explains that regardless of how scary the lesions may seem, they are untreatable, and Joyce will just have to try to live with them and the small risk they pose.
I had to put that on the back burner and remember that this was not the issue I was dealing with at the moment. I still had to try to discover what was happening to my arms.
Her neurologist refers her to an infectious disease specialist to explore other causes that they might have overlooked.
When I went to see the infectious disease doctor, we talked more in detail about what had been going on, what my symptoms were. He asked me when I had had my rubella shot, and I told him it was right after my son was born, and he believed that the symptoms I was having were probably some form of arthritis from the rubella shot.
After quite a bit of testing, the doctor determined that she had rubella viremia.
Rubella viremia is an adverse reaction to the German measles vaccine. It produces arthritis-like symptoms and occurs in 10% of women who have the vaccine administered postpartum.
I was disappointed because it was not an illness that the doctor told me there was any cure for or that there was anything I could do to help myself.
The doctor told us that she was going to have to live with the pain, that it would subside and could come back.
During the next 4 years, Joyce struggles with recurring pain from her rubella viremia. Then, in 1997, a personal tragedy strikes.
My mother died suddenly in the night, and I'm the one who found her in her house. During all of this time, my mother was a great support to me.
She took it really, really hard. I remember her being extremely, extremely sad.
They decided that my mom had died of a heart attack, but as far as we knew, she did not have any heart disease. Even without my mom's help, we went on with our lives. It was difficult, but it was necessary.
Her mother's death is a shock to Joyce, and shortly afterward, the pain returns.
I expected in about 3 months, the symptoms would go away. And as time went on, it wasn't getting better.
I remember telling her, Mom, you know, this is getting ridiculous. Go, you have to go, and you have to figure out what this is. You just have to. You can't live like this.
At her daughter's urging, Joyce decides to review her records and go back to square one.
I knew that I had brain lesions, but I wondered, is it possible? Maybe somehow they are affecting my arm.
I remember being terrified, you know, what, you have something in your brain?
Despite her neurologist's earlier insistence that the lesions had nothing to do with her arm pain, Joyce is beginning to have doubts.
I remembered that the neurologist I had originally seen had called the lesions in my brain atriovenal malformations. So I decided to get on the internet and look that up
Joyce discovers that arteriovenous malformations, or AVMs, are deformed blood vessels in the spine or brain.
I remember vividly her even having a smile on her face, that she might be on the right track.
I realized that there was a type of surgery that could be done on them. On the internet, I found Dr. Metzger, who dealt with that condition.
Joyce schedules an appointment with neurosurgeon Andrew Metzger.
When Joyce came in for her appointment, I reviewed her MRI scans of her neck and her brain. It was immediately apparent that there was not an arteriovenous malformation causing these symptoms. It was a cavernous hemangioma within the spinal cord.
A cavernous angioma is a cluster of weak blood vessels found in the brain or spinal cord that can bleed. When they hemorrhage, the blood puts pressure on the surrounding nerve tissue and causes pain in the part of the body connected to that nerve. Cavernous angiomas can be present at birth or develop later in life. They are found in only 1% of the population.
In talking to Joyce further, it was clear that it had probably bled several times, and each time it bleeds, there is a risk of losing strength and sensation in the arms and legs, potentially even being paralyzed.
He said every time it bled into the spinal cord, that is when all of the symptoms of my arm would happen.
Joyce hit her arms because it was a way to distract the nervous system and allow less of the painful sensations arising from the spinal cord damage to reach her brain.
It's always a little scary to hear a diagnosis, but on the other hand, there was an amazing sense of relief to know, okay, here it is.
But Joyce's relief doesn't last for long. Dr. Metzger informs her of another devastating fact. She has the familial, or hereditary, form of the disease.
I asked him, does that mean one of my parents had to have had this illness for me to have had it? And he says, absolutely. My next question was, what is the possibility that my mom died from a hemorrhage of a cavernous angioma? And he told me it was not only a possibility, it was a probability.
I explained to Joyce that there is a genetic mutation that can be passed from one of the parents to their children, and that there's a 50% chance that that mutation would be passed.
Joyce's next thought terrifies her.
I have 2 children. I thought that means that each of them has a 50% chance of getting it.
Not only did she have this illness that could possibly either lead in paralysis or death, but we could have it too. I just remember it being way, way too much to take in at one time.
Joyce Gonzales has been diagnosed with cavernous angiomas. They are life-threatening, but even more terrifying to Joyce is that her 2 children may have inherited this condition from her. Luckily, there is a DNA test that can determine this. Joyce immediately schedules her children to be tested.
They do a swab on your mouth and get some saliva, and that's it, and then you send it off to the lab to be tested.
It takes 3 weeks for the saliva sample to be analyzed. They are the most excruciating weeks the Gonzales family has ever experienced.
When the results came in, she wanted to know immediately.
I remember going in and getting it and opening it up and looking. It said negative.
She called me so elated.
That was miracle number 1 to me. When my son Antonio tested and came out negative, that was 2 miracles.
Knowing that her children are now safe, Joyce consults Dr. Metzger about how to treat the bleeding angioma on her spine.
Based on the potential symptoms from the spinal cord lesion and the frequency with which it was bleeding, I felt that she needed surgery, but I felt that I was probably not the best person to be doing the surgery, so I referred her to a specialist in Phoenix, Arizona.
The minute you hear the word surgery, especially spinal surgery, a wave of massive concern swept through my body.
Dr. Metzger explains the risks inherent in surgery when one is operating so close to the spinal cord.
Joyce would need a surgery to access the spinal cord and the lower part of her neck. There's certainly a risk of worsening neurologic symptoms potentially even paralysis.
Joyce has to pick her poison, do nothing and risk paralysis due to a cavernous angioma, or have spinal surgery and risk paralysis due to the procedure. It is a difficult choice.
After several discussions, we determined that the risks of the surgery were better than not doing anything at all.
It's always scary, of course, to have surgery. But I was really very happy to know that there might be something that might help my condition and actually stop the pain.
Joyce and her family fly to Arizona for her surgery. They spend the night in a hotel, and the next morning head to the hospital where she's prepared for the procedure.
Part of me knew there was a possibility that I may be left paralyzed.
I remember her being in her hospital bed, and she was all ready to go in, and we had to be leaving, and I kissed her and told her I loved her and that I would see her in 6 hours.
The surgery involves making an incision on the back of the neck and then opening the bone that the spinal cord travels through. And once we've exposed the spinal cord, the cavernous hemangioma is identified.
The total estimated time of the surgery was going to be about 6 hours. I became a clock watcher.
My father was extremely nervous.
As we got closer to the 6 hours, the anxiety level continued to go up. Then we hit the 6-hour mark, and I still hadn't heard anything, and I began to worry. They had complications. Is she paralyzed? Finally, we got a call from the operating room that they'd finished surgery.
I remember just being really relieved, and I looked over at my dad, and he was crying.
And I guess just the entire tenseness of the moment just all came out at one time. And I let go with, a shower of tears.
Joyce is wheeled from surgery to a recovery room, and her family can only wait to see if the procedure has caused paralysis.
I remember them telling me, Mrs. Gonzales, wake up. And when I was waking up, the first thought that came to my mind is, can I wiggle my toes? Can I wiggle my toes? And so immediately I tried as hard as I could to see if I could wiggle my toes. And it was just an amazing feeling.
It is great to see that she could move her feet. She had come through it.
Joyce is lucky. 10 years earlier, she might have died from the condition, just like her mother.
Our understanding of cavernous hemangiomas has evolved quite a bit over the last 20 years. Many physicians, myself included, didn't learn about this in medical school. It's because of subspecialty training and what I see in my practice now that I know about it. We know that most people that have several have the hereditary form of the condition, and we see a fairly high frequency of that here in New Mexico.
2 days later, Joyce is released from the hospital and sent home.
The outlook for Joyce is bright. The cavernous hemangioma that was causing most of her problems has been very successfully treated, and we're hopeful that it'll stay that way.